Professor Dwayne Devonish says the time has come to put the talk into action when it comes to patient-centered care and patient advocacy. He says the study represents a fragment of the contributions, but it lays the groundwork to get the ball rolling. According to Professor Devonish, the patient and the healthcare professional needs to be a partnership.
Education, health literacy, very important. That's something that we have to do as patients. Asserting patient rights. Yes, there's such a thing known as patient rights. We're not talking about civil rights. We're not talking about any other category of rights except patient rights here. Asserting their rights to protest the care that they're dissatisfied with and ensure that the right protocols and reactions are enforced and maintained. I think that's absolutely critical.
Continued professional education training is already in place for doctors and nurses. However, the study wants similar training for other healthcare professionals.
We would like to see in those CPEs courses or skills development workshops in patient advocacy. Because there is a school of thought that the healthcare professional can be part of that ecosystem of patient advocacy. Patient advocacy need not to be centralized in a given role, whether that role is in the role of a formal patient advocate or the patient him or herself, but it can find itself within the healthcare professional.
The study also calls for patient advocacy and patient-centered care practices to be infused in the training of the continuous education for all healthcare professionals and care providers.
We're asking that from the professional standpoint, when it comes to the recommendation, that there's a bridging of the knowledge and experience gap. I think there's a great need for mentorship. Let me just say this again. There's a great need for mentorship in the healthcare system, where a lot of junior doctors can be afforded the opportunities to be mentored by senior and experienced practitioners in their particular spaces.
A 40-page document on the recommendations of patient advocacy and patient-centered care has been prepared to be submitted to the relevant authorities. Trevor Thorpe, CBC News.